It's a game changer. My name is Vicki Tucker. I was a public school teacher in Grapevine, Colleyville, and I'm now retired for 5 years, 6 years. We had gone skiing with my grandson in February, and then we did some hiking up there in Colorado, and we went up this one trail where we took some pictures, and I could not get back down the trail. My husband had to help me down every step of the way because of the knee. And when we got to the bottom, I said, that's it, I'm done.
When Vicki came to me, we quickly realized that she was dealing with quite severe left knee osteoarthritis
and a lot of bone spurs as well.
And after looking at the x-rays, examining the patient, we decided to proceed with a muscle sparing technique. Compared to a traditional technique where the muscle and the tendons are cut, muscle sparing keeps the muscles and tendon intact, and we're able to go underneath and perform surgery.
If he would have said, well, we'll do it this way, I would have left because I knew this was possible. I saw it. And so I'm telling you, this was a game changer. The curved incision led to quicker recovery, less pain, and it allowed me to get back to doing the things that I love to do faster. I am very excited to get back to hiking again with my grandkids, and this time I won't need any help.